Today's drug is tamoxifen, brand name Soltamox. The therapeutic category is that it's a selective estrogen receptor modulator, or a SERM for short. Tamoxifen is an anti-neoplastic agent. It's also considered an estrogen receptor antagonist. Dosage form and strength. The medication comes in a tablet in a 10 mg and 20 mg strength. Tamoxifen also comes in a solution with a concentration of 10 mg per 5 milliliters. It is important to note that the solution does contain alcohol. Indications. The first indication is for breast cancer. The use is in the risk reduction. Tamoxifen is used to reduce the incidence of breast cancer in adult females that are considered at high risk for breast cancer. The next indication is for the treatment of breast cancer. Tamoxifen is an adjuvant treatment for early-stage estrogen receptor-positive breast cancer in adult patients. The medication reduces the incidence of contralateral breast cancer. Tamoxifen reduces the risk of invasive breast cancer in patients following breast surgery and radiation. The medication is also used in the treatment of metastatic breast cancer in estrogen receptor-positive metastatic breast cancer. There are many different off-label uses for tamoxifen, such as progressive or recurrent desmoid tumors, recurrent metastatic high-risk endometrial carcinoma, gynecomastia, idiopathic male infertility, induction of ovulation in breast cancer patients, and advanced and/or recurrent ovarian cancer. Dosing by indication. Dosing for adult females for risk reduction of breast cancer in pre- and post-menopausal females at high risk. Initiate 20 mg by mouth once daily for 5 years. Dosing for adult females in treatment of breast cancer. Regarding adjuvant therapy, initiate 20 mg by mouth once daily with a duration of therapy based on menopausal status. For example, in pre- or perimenopausal endocrine therapy at initiation, the duration is for 5 years. If the patient's menopausal status cannot be determined, the tamoxifen may be continued for an additional 5 years for a total of 10 years. You may switch to an aromatase inhibitor for an additional 5 years. In post-menopausal endocrine therapy, initiation is used for 10 years or tamoxifen for 5 years, followed by an aromatase inhibitor for 5 years. In ductal carcinoma in situ, initiate 20 mg by mouth once daily for 5 years. In metastatic breast cancer treatment, initiate 20 to 40 mg by mouth once daily. If 40 mg per day, the dose is divided into 2 doses. It should be noted that doses greater than 20 mg have not displayed any proven clinical benefits. In premenopausal patients, tamoxifen is offered as first-line therapy in patients with no endocrine therapy or if prior ovarian suppression through an aromatase inhibitor. In postmenopausal patients, tamoxifen is offered as second-line therapy if patients had no prior endocrine therapy. Dosing for the various off-label indications should be conducted only after referring to the most current literature. Dosing seems to generally be between 10 and 60 mg by mouth 1 to 2 times daily, with the duration of therapy being based on the indication. 20 mg by mouth twice daily appear to be a very common dosing for tamoxifen. Mechanism of action and pharmacology. Tamoxifen selectively and competitively binds to estrogen receptor modulators on tumors. The complex that is produced leads to a decrease of DNA synthesis and an inhibition of the effects of estrogen. Tamoxifen is a non-steroidal, non-cytocidal agent that is considered cytostatic since the cells accumulate in the G0 and G1 phase. Regarding the absorption, tamoxifen is well absorbed. The distribution is wide to most tissues with a focus on tissues that inhibit estrogen receptors. The metabolism is hepatic via the CYP2D6 and CYP3A4-5 pathways. Metabolites through both pathways creates substances that are 30 to 100 times more potent than tamoxifen itself. Regarding excretion, approximately 65% is excreted fecally. Half-life elimination, tamoxifen is around 5 to 7 days, and the metabolites are around 14 days. Tamoxifen is highly protein-bound. Special populations and considerations. The contraindications are concurrent warfarin therapy or a history of DVTs or pulmonary embolisms. If patients are on chemotherapy, tamoxifen follows the completion of the chemotherapy. Tamoxifen may induce ovulation, and tamoxifen may cause fetal harm during pregnancy. However, long-term effects on development have not been fully established. Side effects. General side effects are hot flashes, headache, cramps, muscle, bone, back aches and pains, nausea and vomiting, constipation, and diarrhea and anxiety. Some of the more common side effects were flushing, vasodilation, fluid retention, and weight loss. There is a black box warning for uterine malignancies and thromboembolic events. Serious and life-threatening events including uterine malignancies, stroke, and pulmonary embolism. Drug interactions. The general cautions are for anastrozole, letrozole, warfarin, estrogens, cimetidine, mitotane, SSRIs, and carbamazepine. Since the major metabolic pathways are down the CYP2D6 and 3A4 pathways, CYP2D6 inhibitors may decrease formation of potent active metabolites and may reduce the clinical effectiveness of tamoxifen. CYP3A4 inducers may decrease serum concentrations of the active metabolite and may reduce the clinical effectiveness of tamoxifen. Monitoring parameters. Bone mineral density, lipids, CYP2D6 metabolizer status, CYP3A4 status, complete blood count with platelets, pregnancy status, ophthalmic exams, abnormal vaginal bleeding, and patient adherence. Patient counseling information. Tamoxifen is used to treat breast cancer or lower the chances of getting breast cancer. It can be used to treat a variety of other cancers and for other off-label uses. Tamoxifen can be administered with or without food.